This week in Carbon County, a report of yet another overdose due to opioid drugs. According to a new study by FRACTL, Carbon County leads for prescription drug overdoses nationwide. Central Utah Specialist Sam Penrod sat in on a roundtable discussion with community advocates who are now working for solutions.
Where are these people getting treatment?
Why are we calling people who commit crimes around substance addicts and people who are getting it from a doctor dependent?
At the Four Corners Community Behavioral Center in Price,
if we can create some education where we can get help for the overdose, then we can keep our people alive longer in our community.
Substance abuse counselors are getting the perspective of two former users in recovery in an effort to stop people from dying due to opioid abuse. In Carbon and Emery counties, there are 51 deaths per 100,000 people. Statewide, it is 13, a staggering mortality rate that has been on the upswing here for 15 years.
If this had been an outbreak of an infectious disease such as influenza or Ebola or any of those things, they would have buried this county in resources in 2002.
Why is it so pervasive here? Well, some point to the coal mining industry where people are often injured on the job and need painkillers. Others believe the area's high poverty rate leads to substance abuse, and when the pills run out, people turn to heroin. While it's difficult to pinpoint the root cause of the epidemic of overdose deaths in this area of the state, community advocates say funding for treatment is based on population size, not on need. And that makes it much more difficult for rural residents to get help.
We've got a lot of people in the community who don't want to stay addicted. They want help, but there's so much fear, there's so much stigma. If I ask for help, I'm going to go to jail.
That's because there are few treatment options here beyond the criminal justice system.
Those outreached hands were handcuffs.
Tara Wilder has been clean for nearly 5 years. Painkillers prescribed after a C-section led to her heroin addiction. Now a recovery coach, she preaches education.
Prevention is so necessary and so vital. It's 100% preventable disease.
Colton World is in the early stage of recovery. He will hit his year mark next month. Drug court, he says, has given him a second chance.
It's a struggle that I'm going to struggle with for the rest of my life. But I've just had to learn the tools to overcome those struggles and to work through them.
The consensus here, substance abuse is a disease and it is preventable if there are resources to stop this vicious and deadly cycle. Sam Penrod, KSL 5 News, Price.
Wow, Sam, thank you. Prescription drugs affect men and women differently. Coming up here at 6:30, we're going to take a closer look at that and the unique challenges women face when they seek drug abuse treatment.
A man is dead after